Now we have Lukas Widmer with us. Lukas Widmer is Senior Principal Statistical Consultant at Novartis. He is an interdisciplinary quantitative scientist interested in innovation at the interface of academia and industry. While the promise of data science approaches in drug development has been manifold, there are clearly also risks involved, a major one being the introduction of unwanted and potentially unnoticed bias, which could impact patients in an unintended manner. Recently, for example, in COVID risk prediction. Lukas will present a principle-based approach to good data science practice in the pharmaceutical industry and beyond. Please go ahead, Lukas.
Yeah, so good afternoon, everyone. I'm Lukas Widmer from Advanced Methodology and Data Science at Novartis. And I'm really going to cover a sort of a multi-perspective discussion on data science in the context of drug development. And this was co-developed with Mark Bailey, Jonas Dorn, Peter Kruschek, Connor Molney, and David Olsen at Novartis. Quick disclaimer, the opinions expressed in this presentation and on the following slides are solely of the presenter and not necessarily those of Novartis. With that out of the way, I'd kind of like to echo what my Zürcher colleagues previously also said, that AI really has a tremendous promise in healthcare applications. So this is an article from the BBC from 18th of May on a Google AI tool that helps patients identify skin conditions. And as you can see here, this comes with a little exclamation mark already in the screenshot. Suggested conditions listed here aren't a medical diagnosis. And what we're kind of really thinking about is what could happen if this tool does something wrong. So for example, if you have a false positive and this tells you, oh, you scanned your patch of skin here and you should probably visit the doctor. If it's nothing in the end, that's actually not that bad. It costs money and time and some nerves because you might be worrying as a patient. But conversely, if you fail to detect something and then later you have a metastasizing cancer, the consequences can, of course, be already quite dire. So the question for us really is, how can we trust these tools? And this really also comes with a few strings attached in terms of population. So if you think about a tool that might work here in Switzerland, if you roll this out on your Android phones for example, in sub-Saharan Africa, would you expect it to perform the same on people that have different skin types? And unless you explicitly test for that, you probably won't know. And this is, of course, also something that academia has been worrying about. So this is from a paper from this year on stress testing dermatologist-level convolutional neural networks with respect to, for example, in the upper row, sequentially taken images during the same clinic session, where the diagnosis should be melanoma, but depending on the imaging condition that this was taken in, you might get quite different results. And of course, that's not something that is desired, or maybe an even more trivial case in the second row, where by holding your phone differently, you could get different predictions, which is something, for example, you could tackle with data augmentation, but you kind of have to pre-specify that this is indeed something you want to be robust against. So this brings us to the topic of this presentation, good data science practice and what this could look like in drug development. And our aim here is really to learn from existing and future data using advances in science, statistics, machine learning, computation, AI, etc., to increase our understanding of drug disease in patients, accelerate and improve our development projects, and of course inform our and our patients' decision making. Before we proceed any further, I'll go ahead and define a bit what we actually mean by data science and data science practices, and then good practices in the context of drug development. Now for us, data science really is a thing that incorporates multiple perspectives and takes a holistic view. And this idea is of course not new. So if you think about John Chambers' quote from 1993, greater statistics tend to be inclusive, eclectic with respect to methodology, closely associated with other disciplines and practiced by many outside of academia and often outside professional statistics. Yeah, this idea is not new. our sort of starting point was the Blind Smith paper on science and data science from 2017, where the authors propagate kind of three views: a computational view, statistical view, and a human view. And what we like to add here is a scientific and ethical perspective on top. Now, why is the ethical perspective in the center here? I'd like to motivate that with a recent example. You may have come across this news article on how the University of Minnesota got itself banned from contributing to the Linux kernel. So what had happened is that a research group submitted patches to the kernel that on purpose had security vulnerabilities in them, basically as a test to see if this would make it past the kernel maintainer's watchful eye, and made a publication out of that. Out of this followed a community outcry, and I'm just going to quickly cite from the kernel mailing list here. Our community does not appreciate being experimented on and being quote unquote tested by submitting known patches that either do nothing on purpose or introduce bugs on purpose. Because of this, I will now have to ban all future contributions from your university and rip out your previous contributions, as they were obviously submitted in bad faith with the intent to cause problems. So what went wrong here? This research wasn't done with the consent, or like it could have even been commissioned by the kernel community to stress test their processes, but that's not what had happened. And the community felt that their time had been wasted reviewing these kind of useful, not at all useful patches. And what followed was a public apology from the Computer Science and Engineering department, and we're quickly going to cite here. And we rededicate ourselves to educating our faculty and students in conducting research that is not only of the highest technical quality, but also follows the highest ethical standards. So it's even if you submit patches to the Linux kernel, sometimes the case that you're doing research on human subjects, and you need to carefully think about what that implies. And that's why we feel the ethical perspective really needs to be central. And as Doug Altman stated, this might lead to less research, but it's going to be better research and research done for the right reasons. A tool that can help here is, for example, professional codes of conduct, and I link a few in the appendix to this slide set, that can provide guiding principles that are either more outward-facing towards responsible research and innovation, such as, for example, selflessness, placing the needs and concerns of those who depend on us above our own and preventing harm, or skill, continuously aiming for excellence in our knowledge and skill, and then more inward-facing ones towards the research community that are about research integrity, for example, trustworthiness, taking responsibility for our personal behavior and conduct, or discipline, following prudent procedure, also in functioning with others. On this basis, then you can take the scientific perspective that gives you the context, the why. And this is really where subject matter expertise is critical. So for example, doctors or basic scientists that actually work in the lab. And taking the scientific perspective really ensures clarity on the purpose, what the potential outcomes and value of your exercise, data science exercise should be, and what kind of positive or negative impact it could have. The scientific perspective ensures that prior knowledge can be navigated and leveraged optimally, and also should determine what we measure and how. Once the scientific question is clear, we can take on a statistical perspective. And for example, if your leadership just asks you for a p-value, you should probably start asking questions back. There's really no routine statistical questions here, only questionable statistical routines. Statistical thinking then provides strategies and methods to really answer the scientific questions we previously defined. So what we do is translate and precisely formulate the problem. What exactly are we trying to solve? And this can boil down to question types. For example, are we trying to describe a population or design an intervention? And once this is clear, what kind of analytical strategies and methodology should we be using? So should we design an experiment or come up with a strategy for data that already exists? And there, like this target trial versus reality thought process that Hernan et al. Kind of published over the last few years is really helpful. Statistical perspective also really helps us to understand our measurements accuracy, where variation could come from, what kind of biases we need to care about, and how uncertain we are about certain measurements. This brings us to computational perspective, and really this is important that you don't just skip ahead to this, because you'll end up with a big computer, a complex algorithm, and a long time, and that doesn't equal science. So what you have to do here is really consider algorithmic implementations of methods and understanding their computational footprints. So is something actually feasible in terms of monetary and temporal constraints? And then design and apply hardware, software, and then software specifically packages, libraries, and languages to solve this specific problem. Here you also run into technical replicability. So if I give you my code, my model, my data, can you actually get the same result on a different machine across the globe? And if you think about that a bit deeper, this really goes a lot deeper. So I put an iceberg for the human perspective here. If you think about reproducibility, so if I give you my tool in a different clinic that you're going to apply in a different clinic, say in Japan, is this going to work equally well? And that's quite a difficult question to answer. So on the right-hand side here, you see some more principles that I just quickly like to point out. So for example, striving for balance, preventing one person or perspective from dominating a team and leading to weaker solutions. We need to be able to communicate across fields well. Otherwise, we cannot understand it and learn from each other. And of course, we need to be able to translate and operationalize the knowledge into reality, bringing us towards good data science practice. So how can I become a good data scientist, and how can we as an organization build good data science teams that actually make a difference? So we came up with a starting point, good data science principles. You need to have a clear purpose as well as a well-defined objective and scope. You have to build on existing work, critically think about quality. That includes data, methods, codes, interpretation, and communication. Good data science is accurate, reproducible, and auditable, all the way from inception to interpretation. And the foundation for this is really a learning culture and collaborative mindset. Without this won't work. Another starting point are frameworks for good data science practice that Andreas Ruckstuhl and Kurt Stockinger already alluded to earlier in this conference. For example, on the life cycle of a project, this helps you to identify where various practices come into play. And last but not least, there is pragmatic and practical guidelines. So good data science practice, unfortunately, doesn't have a trivial solution, but there is low-hanging fruit that can get you on the journey. And I'd just quickly like to point out two resources that can get you started. A, the Turing Way, a handbook for reproducible data science, and B, a more computationally focused paper on good enough practices in scientific computing. Now, this brings me already to the summary of the talk with some learnings and really a call for questions. So in our opinion, good data science practice really takes a holistic approach and includes people that collectively and collaboratively span a range of perspectives that we indicated earlier. And this usually isn't one person. Unicorns are rare. Good data science principles then provide a starting point and sort of a compass to becoming a good data scientist or good data science team, but this is really something you need to continually work on. And what helps there is having an open mind and being able to balance diverse skill sets, and also having a mindset of continuously improving how we work, learn, and communicate as an interdisciplinary team of quantitative scientists, which is kind of a requirement in drug development these days. And then last but not least, practicing good data science is a team sport. The team greatly benefits if we can communicate our deep, diverse skill sets in an understandable manner, both to each other, but also externally. With that, I'd like to close. A good data science practice is a community effort, so please ask questions or contact us with your ideas. Thanks.
Thank you, Lukas. Very interesting talk. So we have a question here. What is your most important recommendation for good data science practice for the audience, especially to the data scientists in the audience?
So I guess my most fundamental one is really try to illuminate the project you're embarking on from kind of all the different perspectives I mentioned, and think deeply about what you're actually trying to achieve and whether you have all the necessary skill sets on board. Yeah, I think that's kind of, I'd say, the key takeaway.
Thank you. The next question is, what can a company do to control good data science practice?
That's kind of an ongoing discussion. So I recall a blog post from Microsoft on this, so whether you should, for example, have data science embedded in teams or like centralized. And I guess my opinion on this is sort of you should have a hybrid approach. It's quite important that you're close to the application and deeply understand where your solution is supposed to be used. But conversely, it's also important to foster excellence in your organization. So for example, if you have like define best practices, that those are actually applied across your company and also get not just applied, but people really sort of live and breathe this.
Thank you. And one last question is a little bit more technical. If you know your data is biased, what do you suggest to do practically?
That's kind of a rabbit hole to open right there. That kind of depends on the bias that you have in the data, I would say. That might be one for a late, like I don't know, one-to-one. If there's like I'm still on the platform if you want to talk to me in detail about this. But yeah, that's a pretty deep discussion.
Depends on the situation, I assume, on your problem
It
that
depends
you're trying to solve.
on the data we're talking about and what your goal is and what kind of biases you're facing.
Well, thank you very much. You can all reach Lukas in the chat platform. You should also have his contact information if you want to write him an email to keep discussing this. Thank you very much for joining us, Lukas.
Thanks a lot for having me. Have a good afternoon, everyone.
Thank you. Bye.
Bye.